Hi everyone, Dr. Knackstedt. Let's discuss contacts, dentures, piercings, and jewelry for surgery. Let's go one at a time. So contacts. You have to take your contacts out before you go into surgery. And it's always a good idea if you wear contacts just to bring glasses to the day of surgery and if you're staying in the hospital. If you've just had surgery, you don't want to put your contacts in the day after surgery. Your eyes might be dry, you're going to be sleepy and out of it. If you can wear glasses, just bring glasses. Dentures. If you wear dentures, you will have to take them out for the actual surgical procedure, but you do want to bring them with you if you're going to be in the hospital to ensure that you can eat and drink normal after surgery. You can just leave them with a loved one or with your belongings during surgery. Let's talk about piercings. So all jewelry and piercings have to come off before surgery. And the reason for that is a couple things. One is they could get lost. Two, they're not sterile. And three, and the most important thing is if they're metal, they can conduct heat during surgery that can actually leave you with pretty serious burns. So if you can remove a piece of jewelry, always do so even before you come to the hospital. We don't want to have you remove it the morning of surgery and then it just happens to get lost while you're in surgery. Now, let's say you have a piece of jewelry that you absolutely cannot remove. I've had some patients who've had dermal piercings that they can't remove, or they've had the bracelets that are welded on that you literally have to cut them to remove. If there is a piece of jewelry that you absolutely can't not remove, usually the anesthesia and surgical teams will let you keep them on, but you do have to sign a waiver stating that if you get a burn from that, then the hospital and the surgical team is not held responsible. I've actually never seen anyone get a burn from that. We usually tape it really well and reinforce it to make sure that the jewelry is not touching the skin, but it's just honestly not worth the risk if you can take it off. The things to think about then are leaving jewelry and valuables at home, but thinking about what you will need after surgery to help you recover well in the hospital, things like glasses and dentures.